Heart attack. Definition. A heart attack occurs when the flow of blood to the heart is blocked, most often by a buildup of fat, cholesterol and other substances, which form a plaque in the arteries that feed the heart coronary arteries. The interrupted blood flow can damage or destroy part of the heart muscle. A heart attack, also called a myocardial infarction, can be fatal, but treatment has improved dramatically over the years. It's crucial to call 911 or emergency medical help if you think you might be having a heart attack. Symptoms. Common heart attack signs and symptoms include pressure, tightness, pain, or a squeezing or aching sensation in your chest or arms that may spread to your neck, jaw or back. Nausea, indigestion, heartburn or abdominal pain. Shortness of breath, cold sweat, fatigue, lightheadedness or sudden dizziness. Heart attack symptoms vary. Not all people who have heart attacks have the same symptoms or have the same severity of symptoms. Some people have mild pain, others have more severe pain. Some people have no symptoms, while for others, the first sign may be sudden cardiac arrest. However, the more signs and symptoms you have, the greater the likelihood you're having a heart attack. Some heart attacks strike suddenly, but many people have warning signs and symptoms hours, days or weeks in advance. The earliest warning may be recurrent chest pain, angina, that's triggered by exertion and relieved by rest. Angina is caused by a temporary decrease in blood flow to the heart. When to see a doctor? Act immediately. Some people wait too long because they don't recognize the important signs and symptoms. Take these steps. Call for emergency medical help. Take nitroglycerin, if prescribed to you by a doctor. Take aspirin, if recommended. What to do if you see someone having a heart attack? If you encounter someone who is unconscious, first call for emergency medical help. Then begin CPR to keep blood flowing. Push hard and fast on the person's chest, about 100 compressions a minute. It's not necessary to check the person's airway or deliver rescue breaths unless you've been trained in CPR. Causes. A heart attack occurs when one or more of your coronary arteries become blocked. Over time, a coronary artery can narrow from the buildup of various substances, including cholesterol atherosclerosis. During a heart attack, one of these plaques can rupture and spill cholesterol and other substances into the bloodstream. A blood clot forms at the site of the rupture. If large enough, the clot can completely block the flow of blood through the coronary artery. Another cause of a heart attack is a spasm of a coronary artery that shuts down blood flow to part of the heart muscle. Use of tobacco and of illicit drugs, such as cocaine, can cause a life-threatening spasm. A heart attack can also occur due to a tear in the heart artery, spontaneous coronary artery dissection. Risk factors. Certain factors contribute to the unwanted buildup of fatty deposits, atherosclerosis, that narrows arteries throughout your body. You can improve or eliminate many of these risk factors to reduce your chances of having a first or subsequent heart attack. Heart attack risk factors include age. Men age 45 or older and women age 55 or older are more likely to have a heart attack than are younger men and women. Tobacco. High blood pressure. High blood cholesterol or triglyceride levels. Diabetes. Family history of heart attack. Lack of physical activity. Obesity. Stress. Illegal drug use. A history of an autoimmune condition, such as rheumatoid arthritis or lupus. Complications. Heart attack complications are often related to the damage done to your heart during a heart attack. This damage can lead to the following conditions. Abnormal heart rhythms, arrhythmias. If your heart muscle is damaged from a heart attack, electrical short circuits can develop, resulting in abnormal heart rhythms, some of which can be serious, even fatal. Heart failure. The amount of damaged tissue in your heart may be so great that the remaining heart muscle can't do an adequate job of pumping blood out of your heart. Heart failure may be a temporary problem that goes away after your heart, which has been stunned by a heart attack, recovers. However, it can also be a chronic condition resulting from extensive and permanent damage to your heart following your heart attack. Heart rupture. Areas of heart muscle weakened by a heart attack can rupture, leaving a hole in part of the heart. This rupture is often fatal. Valve problems. Heart valves damaged during a heart attack may develop severe, life-threatening leakage problems. What you can do in the meantime. It's never too early to make healthy lifestyle changes, such as quitting smoking, eating healthy foods and becoming more physically active. These are primary lines of defense against having a heart attack. Tests and diagnosis. Tests will help check if your signs and symptoms, such as chest pain, indicate a heart attack or another condition. These tests include electrocardiogram, ECG. This first test done to diagnose a heart attack records the electrical activity of your heart via electrodes attached to your skin. ECG may show that a heart attack has occurred or is in progress. Blood tests. Certain heart enzymes slowly leak out into your blood if your heart has been damaged by a heart attack. Emergency room doctors will take samples of your blood to test for the presence of these enzymes. Additional tests. If you've had a heart attack or one is occurring, doctors will take immediate steps to treat your condition. You may also undergo these additional tests. Chest X-ray, echocardiogram, coronary catheterization, angiogram, exercise stress test, cardiac computerized tomography, CT, or magnetic resonance imaging, MRI. Treatments and drugs. Heart attack treatment at a hospital. With each passing minute after a heart attack, more heart tissue loses oxygen and deteriorates or dies. The main way to prevent heart damage is to restore blood flow quickly. Medications. Medications given to treat a heart attack include aspirin. Aspirin reduces blood clotting, thus helping maintain blood flow through a narrowed artery. Thrombolytics. These drugs, also called clotbusters, help dissolve a blood clot that's blocking blood flow to your heart. The earlier you receive a thrombolytic drug after a heart attack, the greater the chance you'll survive and with less heart damage. Antiplatelet agents. Emergency room doctors may give you other drugs to help prevent new clots and keep existing clots from getting larger. These include medications, such as clopidogrel, Plavix, and others, called platelet aggregation inhibitors. Other blood-thinning medications. You'll likely be given other medications, such as heparin, to make your blood less sticky, and less likely to form clots. Heparin is given intravenously or by an injection under your skin. Pain relievers. You may receive a pain reliever, such as morphine, to ease your discomfort. Nitroglycerin. This medication, used to treat chest pain, angina, can help improve blood flow to the heart by dilating the blood vessels. Beta blockers. These medications help relax your heart muscle, slow your heartbeat and decrease blood pressure, making your heart's job easier. Beta blockers can limit the amount of heart muscle damage and prevent future heart attacks. ACE inhibitors. These drugs lower blood pressure and reduce stress on the heart. Lifestyle factors. You know the drill. Maintain a healthy weight with a heart-healthy diet, don't smoke, exercise regularly, manage stress and control conditions that can lead to heart attack, such as high blood pressure, high cholesterol and diabetes. Thank you for watching video. Like and subscribe my channel.